So before, okay, the next page, before I was on diabetic for 35, since 35 years old. And at that time, I was only on medication. And the doctor keep encouraging me, why don't you use insulin? I say, I don't want insulin if possible, but insulin is faster, I say. But I hear many other things about insulin, which I don't really like it. And since I'm taking tablet, I'm not taking a lot. I say, I just continue with tablets. So they say, okay, up to you, right? Okay, then after this, I didn't realize I had diabetes. I was a chocolate lover, but I did not realize I got diabetes until one day I saw why so many ants in the toilet. Oh, there was a time that I started seeing the doctor. I say I can urine, no problem, everything no problem. I don't feel anything, no problem, except I'm seeing a lot of ants in the toilet. So that's where my suspicion come in, and I seek the doctor's. So I was on medication since then, since 35 years old. Then after that, on when I was 27 years old, I had an ovarian cyst removal. Doctor say it's good, you can remove or you can wait. I say no, I don't want to take the risk because I don't know my body condition. So just go ahead and do the cyst operation. I said, and then later at that time with this cyst remover and also by my diabetic still going on, see. And then 2019, I had this hysterectomy. The hysterectomy is because doctor said there's a lot of fibroid, not cyst, but fibroid, little small fibroid. So I say, then what to do with this? Do I really need an operation? So she said, since you're already at this age, you're already at advanced age, then no need to worry about it. Just do the operation. There's all the advice come from the doctor. Yeah. So after the hysterectomy, there's my health condition become really challenging already. Because you see, how many times I've been operated. Even during the hysterectomy, I was cut a few times in the ward as well as on the operating table. And it takes me 1 year for the wound to close. And the wound cannot close properly because I have fat. I have the fat, layer of fat there. So it keep breaking. So it keep breaking. They keep sewing, also no point. So the doctor said, I cannot sew. I don't know the term, I use say sewing. So a few times until I have to plead the doctor. Doctor, can you stop cutting me? I said, can you stop cutting me? Because of the infection as well. So they had to remove the infection surrounding the wound there. I said, can you stop cutting me? I said, I really pleaded him. Then he said, okay, then let's do a open wound healing. He said, if that's the case, do open wound healing. So that's the case now. I keep on just leave it like that. So that's why now, after the healing, my stomach actually got a valley, got a very deep valley. Yeah. But okay lah, I can manage lah. Even the yawn, I cannot patch there, but I patch on the right, a little bit on the top of the belly button or at the side of the belly button. So that's all. So then after that, next page, Jinhua. Yeah, this is actually my biggest mistake I thought after the hysterectomy, I was okay already, and then I could go jalan-jalan. So I went to Podison, and then I walked to the beach. So, but I didn't realize it actually. The sand and the slipper was rubbing, so already caused a wound there. But I did not go to see the doctor fast enough. I did not go to hospital. I thought, small matter lah. So I dressed the wound myself. But as I dress after 3 months, I see that it become one hole. So the one hole at that time, I think my body here, already contracted inflammation and all that. So my nephew sent me to hospital. Go and check up. He said, Auntie, go and check up. So I said, okay. So that was the time I told I told doctor about my soul, and then doctor said, you are so lucky. You come 1 week earlier. If 1 week late, I have to amputate your leg from knee below. I said, oh really? I said, doctor, can you help? I want my leg. I said, can you help? So what he did was, if that's the case, I have to really open up your soul and then clean all the bacteria and give you antibiotic. So during, you see, when I had the operation for hysterectomy and when I had the operation this toe, they give me the most expensive antibiotic drip. It's about hysterectomy. They gave me about one drip, 1,004. Can you imagine if I every day I have to use a drip, how much I have to spend the kind of money? So and then here this one, they gave me something that slightly cheaper, maybe 500, and then later slowly the doctor gave me a cheaper one, just oral. He said you can buy at the pharmacy. So I say okay. So that is one of it. So this one I don't have the one operated, the one open like a sandwich, but I do have this. You see on the right side is much bigger that time before the patching. After patching, you see I can see it become better. Actually become drier. I would say become drier. During this patching time, there's no more stain, no more blood. For how long I've been having stain with blood, but this one no more blood. So this is one of it, the improvement of the patching. I'm still patching because I want it to be completely closed. It's not because if it's not completely closed, I have to keep bandaging the leg to avoid bacteria going in. Yeah. So then the next one. Okay, this is my dialysis center. Beginning, you see, I was contracted with COVID, so I was admitted to hospital. For the first year of dialysis, I keep vomiting. I just cannot get used to dialysis. I keep vomiting and then dizzy, dizzy vomit. So this year, this month, which I really look much better, you know. But of course, the pain every time is always there because I have to dialysis 3 times. So I'm now using a middle size needle, which can be painful when they poke in. So 4 hours. So this is not yet. This one is actually after patching already. The one non-patching one I don't have. I've changed phones, so many old photos are deleted lah. So the next one. Okay, this is where I started patching on 1st September. Actually, this one patching was introduced by my upline, my friend. We were working in the same company before. She told me, her testimony is like this. She told me, after 3 weeks of patching, she come and see me with the patches, asked me to try. I even told her off. I say, how dare you, after 3 weeks only patching, you come and see me? I say, you yourself not even well yet, but you're already patching. So she told me 1.5 years bucket of tears, and then now she can walk and come and see me, and she want me to patch. I say, honestly, I really thankful for her lah. If not, I would not have this much better life after six months. So this is after 2 months. 2 months I went out to one of the restaurant. So my friend took a picture of me on that. So that was on the first I started patching. I really look bad. I really look bad when she come and see me. And then this is after two months. After 2 months, yeah. Okay, and then next one. Is there any more? Okay. this is something that I really want to share with all the people. You see, when I was patching, actually my condition is specific. So after patching 2 weeks, I already start ordering the rest of the patches because I was having this long post-COVID course for 2 years. Every night I wake up, I will cough about 5, 6 times, and the cough is like in 1 second, very long cough. So I cannot sleep. Every 2 hours I wake up and cough, cough, and cough a few times, then sleep again. 2 hours, wake up again and cough. So my upline in Singapore team said, why don't you use thyroid for your cough? Because she told me the testimony of how people put thyroid, cough went away 3. But I say this is COVID cough, it's not a normal cough. He said, okay, can try. So I tried. So I was patching this glutathione at my throat here for 2 to 3 months. 3 to 4 months, I can't remember that. About what lah, minimum 3 months lah. Right? And then I was thinking about this thyroid. Okay, if I, at the same time, I also heard that this glutathione patching on the thyroid also good for cough and also good for thyroid. That time, the reason I patched glutathione was for the cough, but then at the same time, I heard it also can do for thyroid. So that's why I patched lah. I say, one patch only for 2 function. Never mind lah, try lah. Actually, I'm using my body to try all the patches. So, and then this is what I get. You see, before May, before Lifewave, and after Lifewave went down, and then it went down to 32. Fantastic. When I was at the 62, the doctor's remarks to me was very harsh. He said, madam, if you don't take care of your calcium, and then your thyroid go up, you have to go for surgery, okay? Every time he comes, every 3 months, he'll tell me about surgery on my thyroid. Really not happy about that. Then I said, okay, never mind. Since I hear this about glutathione for two functions, I say I just patch lah. I just test myself. Then okay, so it went down. You see, from 62 went down to 32. This is fantastic, So even because of this, also doctor also had reduced my calcium as well. And then this CRP indicator, that's the creatine protein. You see, not below 6, below 6. This one, when I was in hospital for my feet surgery, my soul, my CRP here was 295. Doctor say so high. I have to pump you with what do you call that? Antibiotic. So I say, okay. Then after that, I don't bother already. 2 years already in and out, hospital. Then he told me, I say, what's the latest now? Doctor say, 25 is still high. Your indicator is still very high. I say, okay, never mind. Then I will start. So this CRP, I just take test only because I just want to know what happened after the 4.5 month patching. And see, the indicator went down to normal, below 6. But this one is after I've done one cycle of CRP, our patching. Yeah. So, but as for because I'm a late stage, end stage of, what do you call it, CKD, kidney problem. So this part of improving is slow, but I can see some improvement. Those supposed to go down, So supposed to go up lah. The reading, yeah. And so I think this is the last page, right? Yeah, this is the last page. So what I really what I really hope for is, I also same thing, like what Shima say, I want to focus on my health. I want to focus on my health. I want to get with this tomorrow will be my 6 month, complete 6 month patching. With all this patching, I can see a lot of improvement. Anything you name it, hair, the nail, or the skin, whatever, I can see improvement, no problem. I basically have used almost everything except the Shine and Dream, which I don't need it. That's all. So I really appreciate those friends that introduce, my upline come and share with me, and also the team in Singapore. They're really good. They are very resourceful people, very good. A lot of things valuable share. So this is how I can become stronger and stronger. And to be on, I'm telling you, I'm already have 6 months X39 in stock and 4 months Eon. I'm planning to use it until end of the year. All the patching lah. Mm.